2013, the American Cancer Society estimated that 580,350 Americans will die from lung cancer. That's roughly 1,600 people per day. November is Lung Cancer Awareness Month, and if you haven't had an annual visit to the doctor, it's a great time for a checkup.
Well, lung cancer is quite prevalent, especially in this area, especially with the coal mining community, where they have underlying lung disease, as well as the increased incidence of smoking in this area. We see quite a fair bit of lung cancer patients. I typically see anywhere between 3 to 4 lung cancer patients a month. So it's quite common in this area.
Lung cancer is an unpredictable disease, but there are signs and symptoms you can look out for.
Well, mainly especially if they have any risk factors such as being a smoker or a family history of lung cancer. I think one of the few symptoms which they need to be aware of is a cough which cannot be explained if they're not having a pneumonia, or a pneumonia which does not go away after being treated with antibiotics. If they are having cough with expectoration, especially if the expectoration or the sputum is blood tinged and there's some blood noted in the sputum, those are certain things which need to be looked for. Occasionally, chest pain can present as lung cancer. That might be the initial presentation. And of course, shortness of breath, if it's getting worse, those may be some symptoms to look for. There's a combination of many factors which play in the development of a lung cancer. A person may be a smoker and may not develop a lung cancer. But if a person may be a very light smoker, but if he has a genetic predisposition for lung cancer, or if there is any other genetic abnormalities going on in his body, he might develop a lung cancer very quickly. Or there are some tumors which we see in younger people, and they're not even being a smoker, they're non-smokers, and even then, without being a smoker, they can still develop a lung cancer. So it's a combination of factors which contribute to developing lung cancer.
Lung cancer has 4 different stages, with various treatments for each. Stage 1 being the easiest to treat, with stage 4 being the hardest.
Stage 1 lung cancer is where the cancer is mainly in the lung itself. It's not spread to any of these green things which are the lymph nodes. As you're aware, any tumor can be treated 3 ways. One thing is surgery, where we go and cut it out. The second method is radiation treatments, where we do radiation treatment and we burn the tumor. And the third thing is chemotherapy, where it is given where the chemotherapy is given through your vein, and it's basically trying to poison the cancer cells. So in an early stage of lung cancer, where the tumor is just in one part of your lung, there's a very good chance that the surgeon can go in and cut it out. Typically, we don't try to expose them to chemotherapy because chemotherapy goes to other parts of the body and has more side effects. If the person who has a stage 1 lung cancer cannot have surgery, maybe they have a weak heart, or they have any other medical problems which is precluding them from having surgery, then under those circumstances we could do radiation treatment, especially CyberKnife therapy, which is available in Bristol. It's the only facility over here in the Tri-Cities area. We have the CyberKnife facility where we do high doses of radiation, and we offer very high doses over a short period of time to just the tumor itself. And CyberKnife is quite an effective way of controlling the disease locally. So that's an early stage disease. In stage 2 lung cancer, the tumor is a little bigger, and the tumor has spread not only the tumor has spread into one of the lymph nodes inside the lungs. The lymph nodes outside the lungs are still not involved by the tumor. So even under these circumstances, if the heart is good and if the patient does not have any significant comorbidities, the doctor or the surgeon can go in and take out one part of the lung, which is called as the lobectomy. And we make sure that the patient can breathe with the remaining part of the lungs before we take out the big lobe of the lung. So we test that. Sometimes after we do surgery, if the cancer has spread to more than 1 or 2 lymph nodes, we do consider post-operative chemotherapy or radiation therapy in that setting. In stage 3 lung cancer, the cancer is a little bigger and it has not only spread into the lymph nodes which is inside the lungs, but it has also spread into the lymph nodes which is outside of the lungs. So that's a higher stage. In this situation, the patient cannot have surgery, because if the surgeon has to cut, he has to cut somewhere around here, and then he would have to take out both the lungs, and as you know, you can't live without your lungs. So normally we don't do surgery for stage 3 lung cancer. In this situation, the most effective treatment for stage 3 would be a combination of radiation and chemotherapy done at the same time. It's called concurrent chemotherapy and radiation treatment. So the radiation doctor would target this area of the body and give radiation to this area, and as medical oncologists we would give them some chemotherapy. And the main reason why the chemotherapy is given here is to not only sensitize these tumor cells for the effects of the radiation, but also if it is spread and if the cancer cells are already circulating in the bloodstream, it could kill those cancer cells too. So that's the main treatment for stage 3. In stage 4, the cancer has spread outside of the lung. There is a chance of cure in the previous stages of lung cancer, stage 1, stage 2, and stage 3, although the higher the stage, the less the chance of cure. But in stage 4, there is no option for cure. What we are trying to do here, because the cancer has already spread into the other parts of the body, we are trying to do treatments to buy more time and to give good quality of life. Typically, this is not a curable stage. Whatever we do in terms of radiation, chemotherapy, or surgery, this cancer is not going to go away. In this stage, the cancer could have spread into the liver, into the adrenal gland, into the bones, or into the brain. It could have spread to any other organs, but those are the main organs which it spreads into. Typically, this type of this stage of lung cancer is treated using chemotherapy. As you can see, if the cancer is in more than one place in the body, we can't do surgery on all the spots which has cancer, and we can't do radiation on all the parts. So if we do chemotherapy, where the chemotherapy is given through the vein, it goes through the body and it goes into the cancer cells which is present throughout the body, and hopefully kills those cancer cells. In stage 4, if the cancer has spread into the brain, normally the chemotherapy cannot get into the brain as effectively, because there is a barrier called the blood-brain barrier which prevents the chemotherapy from getting into the brain. So we do radiation treatment to the brain to prevent those cancer cells from continuing to grow. So in stage 4 disease, this is not a curable disease, but we have good treatment options now, and normally overall survival with treatment is around 1 to 1.5 years. And I have patients who are living longer than that. It just depends upon their comorbidities also. I want to stress that tobacco cessation is a big part of as medical oncologists, we try to treat cancer once it happens. But I also stress to my patients about tobacco cessation, bringing education into the community by various means, and bringing awareness in our community, not only about finding lung cancer early, but also preventing lung cancer is probably a better way of decreasing the overall incidence of cancer in our community. So I would stress on the fact that, as a community, we need to do more to cut down our habit of smoking, and so I think that's very needed at this time.
For more information on the various types of cancer, visit the American Cancer Society at www.cancer.org or consult your primary care physician.